At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live.
Hello and welcome to GLI Live. My name is Sarah Maines and I am the Liver Cancers Program Director at Global Liver Institute. Today, I have the honor to be filling in for our beloved CEO and President, Donna Cryer, for this episode. This October, our conversations during GLI Live are part of our hashtag October is for Livers liver cancer education campaign, the first and only global program dedicated to public awareness, policy, and clinical practice needs to prevent and manage liver cancer while educating and empowering those living with and impacted by liver disease and liver cancer. Today, we will be joined by the lovely Dr. El-Sayed, Professor of Pediatrics at Ain Shams University in Cairo, Egypt, Director of Medical Ain Shams Research Institute Clinical Research Center, and a founding member of the Egyptian National Committee for Control of Viral Hepatitis. Dr. El-Sayed, thank you so much for joining us today. Welcome.
It's my pleasure, and thank you very much for inviting me.
It's so nice to have you here, and you are truly the face of Egypt's trailblazing success in hepatitis elimination. We can't say that enough. A feat that definitely takes collaboration and experience and will challenge to the status quo. So before we dig into all of the amazing things and the impact that you've brought to Egypt, I would love for you to introduce yourself and shed light to the audience on the overview of your career.
Okay, so I'm Professor of Pediatrics and also the current chair of the Pediatric Department at Ain Shams University in Egypt. And as you mentioned, the director of the Clinical Research Center, but I have so many hats, apart from being the founding member of the National Committee for Viral Hepatitis. I'm also work with the Hepatitis Fund as one of the board of directors that's based in Geneva, and on the governing board of the International Coalition for Elimination of Hepatitis B. But most importantly and close to my heart now, I'm the president of the Society on Liver Disease in Africa that we founded last year after several years of conducting a conference in Africa that really, really needs help right now. So I'm shifting my focus now from Egypt after we're getting the elimination to the African continent. My career started in 1990, actually, immediately after the discovery of hepatitis C. I was given a thesis on hepatitis C in children who are high risk. That was my PhD thesis, and it started there. It was immediately after the discovery. We found very high prevalence rates in children who are undergoing blood transfusions or cancer chemotherapy, up to 90% or more. And from there, I started doing other studies, molecular studies, and applying for grants, and then hepatitis B in collaboration with outside the country in Italy and different countries, and then clinical trials with hepatitis B treatment in children. And then I was, after many publications and many presentations, I was charged as one of the founding members for the National Committee for Viral Hepatitis since 2006. And I think we're going to speak about this in the following conversation.
I mean, it's incredible to hear about the work that you did starting in the 90s at such an early point when it was introduced to your country, and just really the thought in general was introduced. And thank you for the continued passion that has not stopped, and how you're also now bringing it from an Egypt-specific issue to Africa. So I'm so excited to be here and support you along the way with that. I'm curious, every country obviously focuses our battle on achieving health equity. what strategies do you feel Egypt adopted to overcome affordability, accessibility, availability, those barriers?
Well, when we started first as a National Committee for Viral Hepatitis in 2006, we were charged with developing a strategy assessment of the burden of disease, and we integrated at that time the Hep C testing in the demographic health survey. And then we were also charged with training physicians, nurses, and developing liver centers within existing healthcare facilities. And at that time, the government negotiated the price, and we were part of this, for the interferon, which was the first treatment for hepatitis C at that time, to 10% of its global price. So that made it much easier for the government to support, and the government decided that this is going to be state-supported. But the infrastructure that we developed a different financial model that could just financially support this kind of model for the infrastructure and the training and the administration and secretariat. We started as 4 scientists and physicians, all volunteers, and we've been volunteers since that time. And during the days and years, few people were added, and then those people went. But the 4 who started the National Committee, now we lost a friend a few years back. So we're still there, and we're still doing exactly the same. We're still supporting the program. The government continued to support the program, but we had 3 phases or several phases, from interferon to the discovery of the new direct-acting antivirals. And we started immediately negotiating the prices to 1% of its global price, proper registration system, database, networking. We had already, by the first week for DAAs, 1 million people registered on our system to receive the DAAs. And we managed to give them those. We had the capacity, we had the liver centers, we had the trained physicians, we had the trained nurses and administrators. So the whole infrastructure was ready for this. And then we had our Egyptian companies developing the medications. So that made the price even lower to over 1,000 of its global price, and made it more accessible. And there was no difference between people. Everybody could access treatment. You don't ask about the risk factors. You don't marginalize people who are, for example, injecting drugs. You don't marginalize people who are from key populations. So I think that was very, very successful. Everybody had access. You just register on the system, and then you can access the treatment, fully supported by the government. And then we had, at the last phase, of course, the screening and testing of the whole population. We started with the adult population and then the pediatric population. And I think we can elaborate on this further.
I mean, it's incredible. We talk so much about the financial toxicity that's related to any diagnosis, and then the follow-up treatment plan. And what you've implemented would be the dream to all countries. It's phenomenal. I'm curious, when you think about, lessons learned, how can we take what you did and implement that model to other countries? What are suggestions you have?
I think, first of all, we need key stakeholders engagement. That's really important, that you engage everybody. You don't leave anybody out. It's important. And actually at the center of our campaign was the media. A very strong media awareness, very strong media education, not only for the public, but also for the politicians, for the physicians, for everybody in the country. So everybody knew something about hepatitis C. So that was really, really powerful. And empowerment of the public was something that was really important as an advocacy tool. You can use the public as an advocacy tool. And you have to engage politicians. You have to engage physicians associations. You don't leave anybody out. And that was one of the key successes that we had. And when we had the screening and testing for the whole population, the whole country was mobilized, from the community, from down to the president. And this was a presidential initiative. So everybody was mobilized and everybody was working in the campaign. So it's the engagement, it's the networking. It's not me, but it's about us all. I think that's something that wasn't in any other country, and I don't think any other country has reached that. Everybody wants something for himself, but if you want something for your country, and everybody works for a single, you have a target, and everybody has the same target, and we all work together to achieve this target. I think that was one of the key successes for Egypt.
Absolutely. That's some of the whole, everything you've talked about is really relating to equitable access. Everyone is the same. Everyone needs the same option and ability. And when I think about education, about treatment, but also prevention, you have done so much in terms of expecting parents and young children. I think that's something that has been really powerful for me personally to hear more about from you and learn. I would love to see, the education for expecting mothers and young families. Obviously, the success of these programs will help the success of generations to come. What strategies did you do specifically to help educate expecting parents to decrease hepatitis? And who would you say led these efforts, and what was that involvement like?
Yeah, I have two parts of this. One part is personal, because I started this very, very long time ago. And whenever I had a child who was infected with hepatitis, I usually did family screening, and I educated everybody about how to prevent infection within the family, and how also, because in the early days we had problems with nosocomial infections, hospital-acquired infections. And I used to teach the mothers and the children how to protect themselves. If somebody takes a sample, what he should do, what are the steps. And it really worked very well. And I think that's part of the empowerment of the public I was speaking about, that you need to educate the public of how the services should be given to those patients, and how to protect themselves and how to protect their families. From another perspective, because I'm also a Secretary General of one of the NGOs in Egypt, it's called the Egyptian Liver Care Society. We founded that NGO in 2008, and actually 2006, immediately after the National Committee. And we started by supporting liver transplant recipients by financially. And then we started a program for children called the Hepatitis C-Free Child Program in 2008. Started with interferon and then with DAAs later on. We equipped centers within university facilities, and we trained physicians for sustainability. We gave them equipment. And part of our campaign and screening and treatment was education of children and awareness workshops with the parents and families, and giving out also prevention material like new toothbrushes, new razors for the adolescents, etc., during the treatment period, and teaching them. And during COVID, we've done something also nice, that we had a phone application, and we taught them how to remotely have chats with us and have conversations with the physicians, and how they can receive the treatment remotely and how to be adherent. The engagement of the children and the adolescents within these activities was really fantastic and very, very rewarding. On another note, through the National Committee for Viral Hepatitis, we had efforts for education and awareness, of course, through the media, through cartoon movies that we developed to WHO. Also a very nice university campaign that I started in 2008. And I realized that the university students are the best people to receive the knowledge, to discuss. They wanted to learn more. They wanted to know about their parents. And I considered them our troops to spread the information to the families. Also during summer camps, we had the same students. We had an actor and an actress with booths in all universities all over Egypt. And we managed to reach out to 100,000 students, vaccinate 30,000 against hepatitis B very early on, before marriage and before conception, and understanding the risks of mother-to-child transmission. And we also had, after this campaign, 6,000 volunteers who worked with us all over Egypt to make awareness, small campaigns in their villages and for their neighbors and for their families. I think that was also very, very powerful, and it remained for years. And surprisingly, even after the revolution, we had two revolutions in Egypt, as you know. One in 2011, the uprising, the People's Uprising, 2011, and then 2013. None of our liver centers were touched. There were campaigns, our campaigns were just affected very minutely, and then later on we came back very strongly. And that was one of the very few programs in Egypt that was not affected by the People's Uprising. The sustainability, the importance, the feeling of ownership, and I think that's really important. People feel that they own the program. This is theirs. They own this program. Even the public, the community, everybody feels that this belongs to them. It doesn't belong to the government. It belongs to them. They have to take care of it.
It's incredible. I mean, it's truly so moving. The more you keep on talking, I keep on getting goosebumps and having that visceral reaction, because you can feel the energy of how your entire country is empowered as an advocate and wants to move change forward. And the model is truly phenomenal. When I look at the impact on the endeavors and everything you've done to eliminate hepatitis in Egypt, obviously that doesn't stop there. And this month, with our focus on liver cancers, I'm curious about, how can we exceed what you've learned beyond hepatitis, and considering the risk factors that hepatitis has with liver cancer? How will those milestones shape the liver cancer landscape in Egypt? And what do you see is next?
Well, we are already working on what's next. We know that after we treat everybody, or almost everybody, you do have still a risk of liver cancer, and it will be still high because people who had cirrhosis and end-stage liver disease are not going to lose the risk for development of liver cancer. So we have a very nice surveillance system in place now in all our liver centers. We have 120 liver centers, or even more, after the 100 Healthy Million Lives campaign, where we tested almost 65 million people, including children in schools, and treated all those who were positive. And then we have a surveillance system now for liver cancer in those centers. So people who had cirrhosis or advanced liver disease, they have to keep coming back for their follow-up. And they're registered on the system, and we know the time for their follow-up. And we introduced also the new medications for treatment of liver cancer to make sure that they have access to the best kind of treatment. So we've introduced the newer treatment, and the immunotherapies now have been introduced in the country. So the efforts are ongoing. The efforts for monitoring morbidity and mortality are ongoing, and the surveillance is ongoing. Reporting system through the labs. We have the lab information system that's connected to the Ministry of Health. So all those who are positive are immediately reported to the Ministry of Health, so we can keep track of what's going on in the community. On a prevention level as well, we've implemented the birth dose for hepatitis B since 2016. We started vaccination since 1992, but the birth dose started in 2016. Prevention of mother-to-child transmission by screening pregnant women with triple elimination, syphilis, hepatitis B, and HIV. So there are ongoing efforts that are not going to stop. The school screening program is still ongoing. So we started with those above the age of 12. So every year we take the category who have grown up 1 year. So we screen them and test them in schools. We're still doing that. So all school children are being tested on a yearly basis. We first started with 12 till 18, and now all those in the category above 12 are being tested every year. We've never been tested before. So I think the efforts are ongoing. We're not stopping there. Although we're getting probably the gold tier award from WHO next Monday.
Well deserved. I couldn't think of anyone better to receive that, and it truly is a gold standard. I'm curious, as you talk about the work that now you're really doing, focusing on the continent of Africa, what does that look like? Where does that begin? How can we help? Global Liver Institute is obviously, we're involved with so many countries and continents. What can we do to support you, and what does this preliminary and beginning work in Africa look like for you?
Well, first of all, it started like a conference that was called the Conference on Liver Disease in Africa. I co-founded it and co-chaired it with my dear friend, Professor Charles Boucher from the Netherlands and Professor Mark Nielsen from the UK. And Charles Boucher, unfortunately, we lost him 2 years ago. He started the virology education. And he came and spoke to me. He said, Manal, how would you like to do something about Africa? I said, I would love to. And that started my engagement. And this year was our 6th edition. Last year, we decided also to found a society because there was nothing working to support Africa at a research level, at investigators level, at proper education and engagement, networking with different continents. So we established that last year. I co-founded that, and I'm currently the president. My vice president is Professor Wendy Spearman from South Africa. And we decided that our first goal is to empower researchers and research. And I think that's something that's highly needed in Africa. Now we know that the burden of liver disease in Africa is very, very high. If we talk about viral hepatitis alone, we have 82 million who are infected. Only 2% are diagnosed and have access and availability of treatment. So it's a huge burden, and there is no resources. So we need to do exactly the same, empower the researchers, scientists. We're engaging actually the community very strongly since the beginning. They are part of our society. They are part of our board. We have full engagement. We're going to develop also special interest groups for different parts of liver disease, because there are also neglected tropical diseases in Africa that are completely neglected in the rest of the world. For example, schistosomiasis, among others. And the combination of those liver diseases with viral hepatitis, with the high burden, is very high risk for liver cancer. We know that in Africa, we have liver cancer in the 20s and early 30s rather than in the 40s and 50s, like in other continents. So there are lots and lots of challenges and barriers that we hear every year. So that's why we're engaging everybody, we're networking with everybody. We want to partner with everybody as a society because we want to really, really make a real impact. We know that clinical trials are now being conducted by Africans in Africa. We want that to change. We need principal investigators that are Africans, who can publish their own work, who know how to collect their data, analyze their data, and publish their work internationally, and start really to be empowered. That's something that we are working on currently.
I love that. Thank you. You have a lot of supporters out there that will be helping lead your initiatives and support this for its success. And in closing, Dr. El-Sayed, I want to give you an opportunity to share final words and takeaways for our audience today, and truly give you some time to end on final notes.
Well, I think it's the matter that everyone counts. Every single person's effort counts. And don't ever be negative. Be always positive. Be passionate about what you're doing. Just giving a service to one patient and curing one patient counts and means a lot. And always be inclusive for everybody. Always try to engage your patients. Try to spend some time with your patients and with the community to talk to them. Give them messages. Give them awareness messages that they can spread around, because that really, really counts. So network, work with others, collaborate with as many people as possible, and I think you can make a huge impact.
Thank you. You said that so well. And with so many cases of liver cancer in the world today that are preventable, it's upstream work like yours truly which helps move the needle forward in the world. So thank you. I am truly grateful and have deep appreciation for all of the work that you are doing and that your colleagues are doing in Egypt. So thank you. I feel hopeful for the future, and we will support you with all of these efforts and initiatives. Dr. El-Sayed, thank you for being with us today and celebrating our hashtag October is for Livers campaign at Global Liver Institute.
Thank you so much, Sarah, for inviting me. It was my pleasure. It's always lovely to speak about our experience, and it was really a pleasure having this conversation with you.
Thank you so much.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.